Hi, and welcome to this month's episode of A Healthier You. Today we are talking with Kieran Powers, who is my personal trainer, and he's going to talk to us about the core and core exercises and why it's so important to have a good strong core. So Kieran, I'll give it over to you.
Okay. I think the first and most important thing to cover when we talk about the core is what are the core muscles. I think when we see the word core, it's a great buzzword, right now. I think we see it a lot in magazines. We hear it on TV. There's often a lot of products that are sold under the guise to help you strengthen your core. And I think that most people feel that the core is their abdominal muscles. While that's very true that your abdominal muscles are part of the core, there's also all of the back muscles and all of the muscles of the hip. Essentially, for our purposes, we can consider everything that attaches to the spine as part of the core. So if we need to strengthen the core, we need to strengthen all of those muscles. That can be the major latissimus muscles of the back. That can be certainly the abdominal muscles, or the rectus abdominis. But I venture to say even maybe more importantly the transverse abdominis, and I'll explain that in a second why I feel that's maybe more important. And very, very importantly, the muscles of the hip, and especially the relationship. And this is what I teach a lot to my clients, and I know Carol will definitely agree with me here, is the relationship between the hip and the torso. We work a lot on squatting, on deadlifting, the deadlifting movement, because essentially those are the movements that we use in everyday life. Squatting, deadlifting, or picking things up from the ground. Those are all major core activities that maybe somebody wouldn't think of right off the bat as something that would be considered a core movement. Why the muscles need to be strong, I think is self-explanatory after our last statement. Basically all of those activities that we do on a daily basis, all of the functional activities, need to come from the core or play a part with the core. Some basic exercises that we might use for strengthening the core would be isometric exercises, and I think that's why we talked about the transverse abdominis. Isometric exercises are predominantly done with the deeper muscles of the abdomen as well as other deep muscles in our body. Some basic exercises, if you were to have the ability to do basic movements, would be the plank. You're going to get me down here?
Yeah, yep, go ahead. Go show us the plank.
Okay. The plank, or the hover, also widely known as the hover. Forearms are basically placed on the ground and the feet are placed in a push-up position. A modification to make this a little bit easier, if this is too hard, would be to simply place the knees on the ground and hold from that position.
How long do we hold it for?
Most isometric exercises you could actually start holding from as little as 3, 4, 5 seconds, but usually I recommend to hold 15 to 20 seconds as a goal. Okay? We can also do this on a side, on the knees as well, for a more modified version, or on the sides of the feet as well.
Wow, that one looks hard.
It is a little bit harder, and once again, we would do this on the other side as well. Once again, these are all exercises that we would do, obviously, if you were in shape enough and you were healthy enough to be getting up and down off the ground. And I recommend that you talk to your trainer, you talk to your chiropractor, you talk to your doctor about exercises that are specific for you and specific for your condition and your goals.
So once we get the plank really good, what's next?
Well, we can move to the hollow. That's a little bit harder. I can show you that one.
Please.
The hollow involves a great deal of core flexion we can start in a very modified state with the legs straight up in the air. The goal is to have the belly pressed in, the lower back pressed down into the ground, and that's where we want to start. We want to start with a very good contact with the lower back into the ground by pushing from the abdomen. And then to make it a little bit harder, we want to start to lower the legs down a little bit, still trying to hold the lower back in firm contact with the ground.
And if you start to lose that firm contact,
you just bring the legs back up again, reassess your position, belly's in, make sure the lower back's in the ground, take a deep breath, and try to start over again. Again, this is an isometric too, so you could hold it for 15 seconds or 20 seconds. To make it harder, if this is too easy, just simply holding the belly into the lower back. You can bring the arms up over the head. You can crunch the abs up, creating a more rounded back. Lower the legs down a little bit more, and you can even rock back and forth a bit in what would be called a hollow rock. It's quite difficult, but it'd still be considered a beginner's exercise.
and of course you always have to breathe, right? I know that's my problem whenever I'm doing these exercises. I forget to breathe.
Sometimes it's hard to remember to breathe during isometrics because you're holding the abdomen, you're holding the sides in, and you're trying to create a nice tight torso. So yeah, sometimes you can forget to breathe.
And where would we go next then?
Like I mentioned earlier, I'm a big proponent of learning how to squat, learning how to deadlift.
And why are they so important?
The deadlift, it sounds a little scary. Deadlift, it sounds like a big word. It sounds like something like the big strong guys at the gym would be doing. But basically, for our purposes, we can view the squat as something that you would do every time you get in and out of a chair. You're squatting. Every time you pick something up in front of you, if I were to pick up this mat, I would be deadlifting. So learning how to squat, learning how to deadlift is very important overall, just for your overall functioning in day-to-day life. The interplay of your core with those exercises is something that training can help you immensely with, and working on your core musculature will improve your ability to do those movements as well as your athletic movements that you might be doing. Just to show you a basic bodyweight squat and a basic bodyweight deadlift. Very importantly, I start again with pulling in the belly, pulling in the pelvic floor. Both of those will give you, or should give you, a neutral pelvic position. I like to look at my belt. It gives me a very good place to look at and confirm that my pelvis is neutral. If I see my belt is fairly straight, I can know that my pelvis is fairly neutral. If it were tilted forward, we would consider that an anterior pelvic tilt. You might feel pressure or tightness in the lower back. If it were tilted backwards, a posterior pelvic tilt. These are all very common to normal postural positions that you'd see with yourself or people around you. So we just want to keep a neutral position by pulling in the belly, pulling in the pelvic floor.
Kieran, I only have a minute left, so show us the deadlift, or show us the bodyweight squat and the deadlift, and then we'll continue on in another episode.
Excellent. Okay. It's a classic trainer trait. We talk way too much. Arms are out straight, belly's in tight, pelvic floor. We're simply going to bend from the hip with a straight back, coming back up. Make sure your feet are grabbing the ground. Use your toes, use your full foot. Body weight squat.
And show us the deadlift now.
And a body weight deadlift, or bending over, feet are closer together. Same thing with the pelvis and the belly, but now it's a whole lot more flexion at the hip.
Well, that's great. So Kieran, thank you very much for these great ideas, and we will see you next time on A Healthier You.